Hi, I'm Shelley.
And I'm Kate, and you're listening to One Lump or Two,
The boldest breast cancer podcast yet.
Join us each week as we offer an intimate glimpse into the challenges and triumphs of facing breast cancer head-on in our 30s.
In Series 2, we're going to be joined by you, our listeners, and some experts in the field to help us all feel a little less alone and a lot more informed.
Now, let's pull back that curtain and dive in.
Hello and welcome back to another episode of One Lump or Two. So today we're talking to the fabulous Jamie, and I met Jamie when I started working for the NHS. She is a trans woman and she is here today to talk to us about the issues and barriers that trans people face accessing healthcare in general, but also more topically, the issues that trans people face with cancer screening, checking for cancer, going to the doctor in the hospital with cancer symptoms. So yeah, it's an incredibly educational and interesting conversation. So grab a cuppa, sit back, relax and enjoy. Hello, Jamie.
Hi.
Thank you so much for coming on the podcast.
Thank you for inviting me.
Are you excited?
Very. Nervous.
Don't be nervous.
Don't be nervous.
I'm super excited to talk to you because I think this is a really important conversation and one that's really never talked about enough.
Yeah.
So do we want to start just with you tell us who you are and, you know, what's going on basically?
Perfect. My name's Jamie. I work in the NHS ambiguously. I won't give away where or when. I'm a trans woman. I've been out for about 5 years now. Happened mid-pandemic, so I got to enjoy transitioning through the pandemic, and I'm passionately advocating for trans people in UK politics, and particularly within the healthcare industry.
Yeah, I think it's so important, and I think the UK has kind of is going backwards a little bit in terms of trans right and trans acceptance as well. Like, I just think we're going in the complete wrong direction.
Yeah, so particularly with the UK, I mean, it gets called Turf Island
Yeah.
for a reason. There was a trans woman who got extradited, and she actually got I've forgotten the word. What's that? She was allowed not to be returned to the UK because the UK was so transphobic. They thought you're not going to be tried fairly. I mean, we've had lots going on. The media is sort of whipping it up into something where it doesn't need to be. Trans people make up a tiny, tiny percentage of the population, and giving rights to trans people is not going to remove them from anyone else. It's just going to give them to trans people and give them equal access to healthcare.
It's a lot of like scaremongering, isn't it?
It's a lot of scaremongering.
And I think it was in the news recently, and correct me if I'm wrong, that trans people are now going to be seen in their own separate ward rather than being on the ward what they identify as. So like trans women will not be allowed in the women's wards, which is...
How is that okay?
Yeah, it's not. And I think even it's based on nothing, because no one has ever once complained about being scared
I was just going to bring that
about
up.
having a trans woman in a women's
None
ward.
of the complaints about the wards I can't remember the exact statistic, but it was like in the last 10 years have been about trans women.
No,
in
never.
Women's wards. Like, it's not an issue.
And so instead of, focusing on the 6 million waiting list or whatever it is we've got, they're focusing on something that is not...
We're creating an issue.
Yeah,
Creating
out
a
of
problem.
nothing.
And again, if we can't make new wards for current hospitals, how are we going to have wards just for
Yeah.
trans people? They're not going to emerge out of nowhere and just magic up a ward because they feel like it.
But
NHS has been asking for them for ages.
Even doing that has huge mental health repercussions, because you're being treated like you're different, and
I think it's not just different. It's
you're
like,
asking for acceptance a lot of the time, and it feels very isolating.
it's not just the isolation for me. It's the idea that we're inherently a threat.
Yeah.
Like the idea of, I don't know, being in a car accident, me being carted off, and then they decide, actually, we're going to put you in your own room because you have an M on your birth certificate. I just don't understand how that's relevant when it should be about the healthcare coming first, not whether someone's
It's you as the person.
Exactly.
It's not about whether you're male, female, whatever. You are a person.
Exactly. I'm just there to receive my healthcare.
Yeah.
Yeah.
I don't have an ulterior motive.
Yeah.
Yeah.
And so we obviously are not experts on this, so this is going to actually be quite a nice, like, educational kind of episode for us as well. You have a lot to say. I know you do.
Yeah.
So I don't know how you want to start, like, with if you want to, kind of chat about healthcare in general.
I think that's probably the way forward, because it can sort of highlight a lot of issues with UK healthcare, particularly the NHS, but also just generally, that then spiral out into serious, I was going to say, conditions like cancer.
Yeah.
But it's easier to sort of explore them at the sort of local level. So, as I said at the beginning, I've been out for 5 years. I still not have received my first appointment letter. I
Yeah.
haven't had we've got your referral letter. I have had nothing at all.
Wow.
That's over 5 years. So all the hormones and surgery I've had have had to be private.
So you've had to pay for those
Yeah.
yourself.
And it's not a matter of just, if I wait, it will be free. Frankly speaking, it was life-saving care at the time.
Yeah.
It was not something I wanted to do. I did not want to spend more money than I have on this care. So because of the abysmal state of the current NHS gender identity services, lots of people are forced to go to private healthcare providers. And it's not great, but at least it provides a sort of temporary solution. But then again, only for the people who can afford it regularly. There's people who have been waiting decades for their care.
They've closed down a lot of gender identity
They
clinics,
have,
haven't they?
And again, the gender identity services that they're going to be offering are going to be changed with the CAS review that has come up recently. It's going to be reduced. For most things, the age of consent is like 18, 21. But for some reason, they're proposing gender care should be postponed, because even at 21, you're not meant to be able to make, decisions about having hormones. But,
It's ridiculous.
yeah, it's just not fair. It's not equal, and it's coming from a place of like a weird fear. It's a whole phenomenon. There are people 10 million times smarter than I am who can go into more depths about it, but it seems to be quite British,
Yeah.
but also growing quite quickly as sort of an element of a far right thing. I won't get too political, but it's picking up pace as a nice way to just, everyone has an opinion about it.
Yeah.
But chances are most people have just passed a trans person in the street. You probably
wouldn't
don't
know.
know one,
Yeah.
It's, yeah. I've got a sticker somewhere that just says a trans person used the bathroom here and you were okay, you survived. So that's generally my approach. But yeah, so as well as it being sort of institutional, it's worth saying it can also be like a personal level. So although there are, the NHS is very slow with trans healthcare, and there are points it doesn't help trans people, that may not be down to the individual. Again, I work in the NHS. I love the NHS. There are so many people there who are so open and are just focused on actually providing the best care they can for their patients, but the institution is sort of preventing them.
Yeah.
And then it's also the other way around, where there are, sometimes the NHS can be trying to do the right thing, sometimes misguidedly, but it can be stopped by individuals who have been paying attention to, the sort of scaremongering that goes on in the news too frequently, and end up with a sort of personal prejudice that can interfere with the impartial care they're meant to be giving.
Yeah, absolutely. And it is dangerous when you have these people, Rishi Sunak made a speech not too long ago at whatever summit it was, I can't remember, but he stood up and said, like, a man is a man and a woman is a woman, and that's common sense. And that's such a dangerous thing for the leader of our country to be saying, and that is where a lot of people will probably get their opinions and ideas from. Some people might not have even had an opinion about it, and now all of a sudden, Rishi Sunak said it.
Exactly. Again, we're such a small proportion of society that this amount of discussion is just not merited. Like there are more left-handed people. Why isn't every other news story about that? Like, it just doesn't make sense. But as easy as to just see this as just like, oh, just saying something like a man is a man, a woman is a woman, it's, you know, blah, blah, blah. Things like that can spiral so quickly. They might just be, you know, someone just trying to join in on a political heated debate that they've seen online or something. But these do have real consequences, not just for healthcare, but, you know, like Brianna Jay's murder a few years ago. That was the direct result, I think, of the way transphobia is ingrained in our society. And it was so prevalent. And at that point, I was hoping that, you know, we'd be able to have a discussion that was more along the lines of maybe this is actually causing material harm. And then Rishi Sunak just makes a little joke about it in the Houses of Parliament directly after. And it just feels like if even a young woman's life being taken isn't enough, I don't know. I'm a bit too pessimistic here, but but it is, it's very disheartening to see that this sort of, this non-issue. I mean, how many times have people gone into the bathroom and just wondered about the person sitting in the stool next to them, and that's what
Never.
keeps you up at night? That's what you want to dedicate your life to.
Never.
Yeah, literally
It just,
never.
it
Only
just
thing
doesn't
I'm
happen.
thinking about in the bathroom is, this is a good wee.
Yeah,
I don't care
That's
about
that-
who's
exactly.
Or
around
if you
me.
walk in and you think, oh, these toilets are gross.
Yeah.
Like, literally.
that's exactly
Or
it.
the only time I might consider someone else is when my daughter's in there with us and she's commenting, as she does very loudly, on aspects of my body. And then I
For
think,
everyone to hear.
Oh God, like who else is in here
somebody
listening to
else
this?
just heard that.
Yeah. But you're never worried about like the what gender they are.
No. Just like, oh God, now everybody knows what colour underwear I'm wearing.
Yeah.
And why did I choose that pair of underwear with this dress?
Oh, honestly, it is. It's
Yeah.
ridiculous.
One of the other things is, particularly with the NHS, we don't have a sort of unified system. Again, I'm not going to go on a tirade, but with privatisation, we've got thousands of computer systems, software that all refuse to talk to each other and just work with each other nicely. They refuse to get along, which means I don't know what's on different parts of my healthcare.
Right.
So there's not like a centralized master record that commands all the others, and all of the others are identical to this. If I go to a hospital in one place, they might have a different gender marked next to me as opposed to another hospital. I don't know what's on mine. Obviously, we're not allowed to look up our own records,
not,
but I
no.
don't know whether it says M next to me, F, or not known,
And you
or
shouldn't
X.
have to like request your medical records
Exactly,
and go
but
through and get it corrected.
Where it becomes more insidious is that can affect my healthcare.
Yeah.
So, quite frankly, I'm not too bothered what it says. I'd like to not be misgendered when I'm at the doctor's or anything. But where it becomes much more important is when you go for tests and things, and then they interpret the results based off that one letter that's next to you. I've been on hormones for a long time, and not too long ago, I had a call from my GP saying, we're really worried about your estrogen levels. They're really high. And I went,
Good.
yeah, I'm...
They're supposed to be.
Thank you.
It might be the estrogen I'm taking. Yeah, like, it's just bizarre. But then the opposite happened. My testosterone's really low. So when I was applying for the private clinic, they said, get some blood tests done. And then my GP was like, I don't know why you had these tests done, but your testosterone's really low. And I went, oh, but I'm actually getting them to transition. You know, I kind of, that doesn't sound too bad to me. And they went, oh, okay. And that was it. But they wanted to have a discussion with me based on the letter that was next to my my care record.
We perceive you as
Male. So they
male,
went,
so-
that's really low. We need to do something. And then they went, oh, if it's an F, then whatever.
Yeah.
And I still haven't been able to follow up with it. I don't know if it is an issue or not.
You still don't know if that's been changed, like whether whether next
Exactly.
time that test happens, it's going to be the same issue.
Exactly. It's all depending on this one letter that's next to my name. I mean, I'll probably go into it a bit later, but there are instances where you can be offered or not offered care depending on what letter is next to you, regardless of test results or anything. So for cholesterol, it's whether you're offered statins or not. It can depend in certain circumstances on what's next to your record.
Right.
The same with kidney dialysis. There are instances where it would work for me to have one letter next to my name rather than the other, and
Okay.
vice versa. There are instances where, healthcare professionals will say it's to do with bone density or hormone levels or genitalia or whatever, which is fine, but then they will base the entirety of that care upon that letter without going into the sort of nuances behind it. If my hormone levels are a certain way, but I have an M next to my name, they might offer me something that they don't otherwise, and vice versa. And there's no way to know what they're looking at without asking directly.
And we
Which
know
one's
that
beneficial?
all of the hormones in our bodies play very different roles, and they're affected very differently by very different things, and very easily in some cases. And like different treatments can have a completely different
Exactly.
effect because of the level of one thing in your body or not.
And it's not just whether we're taking HRT or not, hormone replacement therapy. Theory. But it's hormones level change throughout your life.
Yeah.
You know, they fluctuate for so many reasons, and they change so much, and yet oddly they're sort of a weirdly under-researched area. So we have plenty of knowledge about like the obvious effects of HRT, but we don't know a lot about, for instance, what it does to like the internal organs. There seems to be some sort of thing going on with feminizing HRT, so estrogens and stuff, and cardiovascular disease. We're not quite sure what it is. So, it's not even at the stage where we're getting enough papers and research to be able to say, oh, there's a bit of a link. It's just there's something, but
Something there.
yeah,
Don't worry about it.
yeah. There's a lot of things like that just aren't being researched either. So hormones are quite an important part of trans care. Not everyone takes them. People take different ones. But because they're so important, trans people have to sort of argue for them. One other thing I wanted to mention was what we like to call trans broken arm syndrome.
What is that?
It's quite a memorable name. So let's say I go to the GP and I've broken my arm, and I say, what do I do? What happened? I keep breaking my arm. They will probably stare at me for a few seconds, look at my care record and go, it's probably the hormones. It's probably that. And maybe it is, but the number of times that trans people have gone to healthcare professionals and just said, I have X issue, and they go, yeah, it'll be because you're trans. It's probably that.
Wow.
And you go, okay, really? There's so much that's like happening to trans people's bodies that maybe there is some connection with certain things they go to, but it's enough that there is a nickname in the community, trans broken arm syndrome, that doctors will just go, yeah, it's because you're trans. That's why
I
X
think
is
in
happening.
general as well, it's just also really easy to blame hormones an awful lot. Like, because there's so little to some extent understood about the effect that they're having on your body, on our bodies in the sense that we're in. I think it's so easy to just put things down to the unknown almost than actually
Try and
work out what's happening.
Yeah.
Which is what you should be doing.
I've experienced this myself, where I went, I've got this problem. What do I do? And the GP went, okay, right. I think it's because you're on HRT. And I went, okay. I mean, I don't understand, but sure.
So what are you going to do about that? Because I'm not stopping that.
Yeah.
Like,
But then the next month I went to the endocrinologist and she went, I have never heard of that being associated. I have no idea.
Okay.
I would refer you to X team, Y team.
Yeah.
It was just this sort of like thing that you can pin all your diagnoses on, and it's not necessarily. And again, it might be, but again, because we're lacking research, we're lacking resources into it, we don't know for certain. But it's bad enough that trans people have a nickname for it in the community.
Yeah,
where,
you shouldn't have to.
Yeah, you will have to advocate for yourself and be like, I don't think everything is because I'm trans.
100%. Absolutely. There'll be no, that actually that really baffles me.
Makes
And
me
I
feel
think
like I'm
obviously
hungry.
it comes like from a really privileged position that we don't really have to think about stuff like that. And do you think it's because like
GPs, obviously there's just not enough kind of research or infrastructure about it, or do you think it's just because they don't care?
I think it's not just like a lack of research. I think it's just a lack of knowledge about it. So if your patient comes in and they've got this thing that says they are transitioning, that could be a huge unknown to you. You might not have much of an
Might not
idea
have any
what
other
that
patients.
involves.
Like you could be their first patient,
Exactly.
especially if like the pool is so small to some extent.
Exactly. So it's not like a well dealt with thing. And again, because of the way the NHS is, like trans people have a sort of, I think, a generalised distrust of the NHS because it's so slow on healthcare.
Yeah.
For us in particular, test parameters are off, and because the systems don't talk to each other, the chances of someone misgendering you or using the wrong name or just mixing up details about your record because of a letter on it leads to a sort of general distrust. And then when you go into a GP's office and you say, I've broken my arm, and they go, okay, let's talk for 20 minutes about your hormone regimen.
Well, they
And then you
obviously
just
wouldn't
go,
have.
"Why?"
They wouldn't talk to you about that if you weren't trans. So I don't know why that even comes into it.
It just seems to sort of come up in every medical conversation you will have. Will just be like, okay, but let's go back to those hormones, or let's go back to these surgeries you've had. And again, they might be relevant, but they aren't always, and it
Yeah.
always comes under this sort of, I don't know much about it. Let's talk about that to explore it, and it just becomes exhausting after every
Yeah.
appointment is just going. Okay,
And I know
here are
like
the hormones.
the
blah, blah, blah.
broken bone is an example, but it's a bone and it's broken.
Yeah.
Like it doesn't matter what's happening with the rest of you at that point.
Yeah.
It needs fixing.
Exactly, and
And
to just be having this conversation that's meandering nowhere. And you go, I'd really just like someone to
strap
put
it
in a
up.
cast. Yeah,
Nothing else matters.
Yeah.
Just
Yeah.
fix my arm.
exactly.
Oh God.
One of the other major things that comes under the sort of umbrella of trans experiences of healthcare, particularly for one lump or two, is screening. So, again, because any record will have an M or an F or an X or a not known, unknown, whatever systems, whatever drop down menu there is on the
It's literally
computer.
Like male, female, prefer not to say.
Exactly.
Oh no.
But then
That is honestly like the three options.
But
you
then
get.
it's weird because if you say prefer not to say, that means that on your chief record you have to have said prefer not to say. So it's not just if I say that to my GP.
Yeah.
You might have someone who works at a certain hospital who's eyeing you up and frowning and saying, "You Mister or Mrs."
Right.
And you're just like, "I'd prefer not to say."
Yeah.
But then if you look that up on the system, if actually your system, the chief record says M, that's not going to match up. So they're going to have to re-enter your data. It's just the little things. But yeah, in terms of screening, a lot of them depend on automatic IT systems that roll
Yeah.
out depending on what's there.
So we had a couple of questions about this. We talked about this the other day, how things like getting your prostate checked will heavily depend
Exactly.
on being male.
Yeah. And it will be, chances are it's going to be rolled out on the basis of what's on your record at the time. Let's say I for whatever reason, they're all happy with me and they just go, you know what, yeah, we're going to change everything on all your records to F. I don't know if that makes me eligible for prostate screening, which is a bit of a concern because I would like to know if I have prostate
Still
cancer.
have a prostate. Yeah.
And even just in other things, let's say it says F, no one can tell that I'm trans, blah, blah, blah. I go into a healthcare setting and then they just completely omit they don't include that in their differential diagnosis because they just go, I assume there's no prostate.
Yeah.
Again, that's not ideal, but I don't want it to have an M next to my name because that's not who I am.
And then it becomes something that you've got to add to your checklist of things to potentially ask about,
Exactly.
which is a huge thing to then have to ask about.
Particularly in regards to screening, screening is meant to make it easier for just the patient to just go, oh yeah, no, that sounds like a good idea. I would like to know if I have, colon or bowel cancer, breast cancer. If they're asking me for a check, why not?
Yeah.
But for this automatic system to exclude some people just doesn't make sense. It's sort of counterintuitive. It's going against what the system is meant to do, which is to get as many people as possible to get screened. So you don't want it to be the impetus to be on the patient.
Totally.
Like Macmillan, they recommend, like, if you have vaginoplasty, when you are screened for colon cancer, let them know, because that does affect your risks.
Right, okay.
Again, there's not much data on how and why, but
But it
we know
does.
it does. But again, it's the sort of, you should let them know, rather than your
They
GP
should
will
already know.
already know and will contact you because of the difference in
Yeah.
risk levels. It's you should let them know.
Because also, who's going around thinking, oh yeah, it's about time I had that letter through? Like,
Exactly.
every
Well, you
time.
just go on with your life, and then the letter comes through the post, and you go, oh yeah, I should book that
Yeah,
in.
like,
That's-
not once in my life has I ever thought, I need to go and get a smear
That's
test. It's
that's
just,
exactly what screening's meant to do.
Yeah.
You're meant to be invited in to do it, and
Yeah.
to just have a system that might invite some people but not others, or would invite people who don't need it. Like, I'm sure there are plenty of transmasculine, trans men people out there who are invited to prostate screening, and
Yeah.
you're just going to turn up and be like, what
I
I need
I
this?
don't need this. Yeah, and they also wouldn't be invited for breast screening,
Exactly.
depending on whether they feel they need it or not.
And even just on a level of not even just whether I need the screening, if I turn up to a prostate screening, I'm going to feel incredibly uncomfortable to the point I would, again, saying this as someone who works in healthcare, I would consider probably not going or trying to find a way to be seen privately
Yeah.
or in a different room. But I would be having to go out of my way because of the the sort of general air of hostility we have in the UK and worldwide. If I turn up to a room, there will be people who will be looking at me funny, whether that's staff or other patients in a waiting room. They might use the wrong name, the wrong gender. It's just a mire of little things that are going to add up, and there will be so many people who, even if they are screened correctly, will end up going, it's just not worth
That
it.
was a horrible experience.
Because
Yeah.
if it's a horrible experience, you're not going to go and do it again, because
Yeah.
you're going to
No.
remember that horrible experience,
Exactly.
and you'll just put off. And the
Like-
huge detrimental effect that could have if it turns out that screening could catch something
Exactly.
is massive.
And just to come back to it, I think sort of trans rights is going to be, it's beneficial for everyone, not just trans people. Cis men can get breast cancer.
Yeah.
It's a much lower risk, but you can. And I think there would be plenty of cis men who would just go, I'm not going to breast cancer screening.
Yeah.
I'm going to stand out, I'm going to stick out like a sore thumb.
Yeah.
Whether that's healthcare staff or patients looking at you funny, or just being passive aggressive, or saying, are you meant to be here? What are you
Yeah, are
doing
you
here?
in the wrong place?
And then whether it's embarrassment or anger, there's so many little emotions coming up that you might not want to go for screening. You might not want to turn up for your appointment.
Yeah.
It's a big mental burden to have, because there's no there's no guidance in the NHS on how to kind of screen a trans person, how to screen
Yeah.
a trans woman for prostate cancer. There's no guidance out there. There's also no guidance for the trans person themselves on how you might want to kind of prepare yourself for these kinds of screenings. And it's obviously going to differ from person to person, but I've never once seen any kind of help out there for trans people when, they screen or they screen themselves. There's not really anything out there to kind of help people prepare themselves mentally for something that's going to make them uncomfortable.
Yeah, it's just that there's no real, like you said, there's no guidelines, but there's no real knowledge for just people. I'm guilty of it myself. We tend to think of breast cancer as women's cancer,
Yeah.
gynae cancer as women's cancer,
Yeah.
prostate as men's, blah blah blah.
It's very black and white.
Yeah, exactly. And even, let's say, marginally, it was like 1 in a million people who don't fit into that category. That's still one person who's being left out every time. It might not seem like a huge number statistically, but if trans people are just left out each time, it mounts up.
Yeah.
And not that even one time should be excused, but it does have a huge impact to know that you might not be screened correctly. even if you are screened, you might not be treated the same, given the same access to healthcare. And even if you are, maybe the administration will be really horrible. Maybe you'll go up and they'll try and do the procedure, and people will just be passive aggressive. Won't think you're the right person here. Think you're a visitor instead of the patient. It happens, and it just adds up in a way that just leads to a sort of general distrust of the NHS, unfortunately. And the other thing is this is all just sort of making huge assumptions about healthcare as we understand it. We don't have a huge amount of data on trans people and cancer.
Yeah.
We just don't. There has been so little research done that it's worrying. Like, for example, with prostate cancer, we know estrogen reduces the size of the prostate, and the smaller the prostate, the lower the risk of prostate cancer. But we don't know how that relates to people taking feminizing hormone regimens. We know it can be used as a therapy. We don't know about it long term, what's optimal. We just don't have these research parameters. We don't know if certain forms of HRT can cause cancer, if there are complications from surgery that can have long-standing issues. There's just not this research being carried out. So even if we end up screened in the quote-unquote right way, according to what's on your birth certificate or whatever, it might be that because of your being trans, that the care that you're offered, the diagnoses actually vary. Like, we have test parameters. If you've got certain blood test results and they're above a margin, that comes up as red, and they go, "Oh, we need to look into that." Or if it's under, and they go, "Oh, might want to change that. Have a look into it." But trans people, particularly those on hormone replacement therapy, have different bodies.
Yeah.
It changes those parameters, but there is so little research into how those parameters are actually different. What is a standard, I don't know, cortisol level for a trans woman or whatever? We just don't have these parameters out there. So it's either going to be your bloods are measured up against a big M on your birth certificate or a big F.
Yeah.
It's one of the two. There's nothing in between. And I understand it's necessary for healthcare. You can't have every single thing personalized to you. But at the same time, we have seen increasing research into the needed or the sort of healthy parameters, ranges, measurements of certain body functions that are counted as healthy, and those relations to whether you are trans or not. But again, because we don't have the research, we can't really say much. Like, there are plenty of good organisations out there, Cancer Research Macmillan, who have swathes of information and advice about how to navigate through cancer if you are trans, but they can't really say much about the risks of cancer if you are trans and how they change, because for some things we have a general understanding, but basically just a direction. I am at higher risk of breast cancer than cis men, but lower, estrogen, but lower than cis women. However,
you actually don't know what that specific
exactly
is.
I don't know which of the medications it is, if it's all of them, if the effects only kick in after a while, if starting them later in life would have affected my chances taking them earlier. I don't know. There's just so much I don't know about it that we can basically just go, we think there might be some connection, but we can't go much further than that without further research. One of the reasons that so little is being researched is not just because trans people make a small proportion of the population. It's, I think, because of the sort of general atmosphere we have. It's as much as it's said that it's the new hip thing to be trans or whatever. It's the next craze the kids are going mad for. But you might lose your grant, or you might lose funding from someone who just goes, actually, I've read J.K. Rowling's tweets. I quite like what she's got to say.
I'm not
going to give you money.
Anymore,
Exactly. It's not just individuals. There's a sort of general, like you said with the wards earlier, we're moving backwards in a sense, and I can't see just increased funding in that research without something changing. Yeah.
And it's not just like, I mean, we obviously are in a very privileged position that we're white, cis females, and I've never ever got into a healthcare setting and had to think, oh, I wonder what this doctor's beliefs are, or I wonder what, like, I've never had to do that. And it's just kind of like, and I was ignorant to it before, and it's just kind of sitting here talking to you, and this conversation has been so interesting that, like, yeah, you probably have been into a healthcare setting where you've thought, I have to consider what this person thinks of trans people, and the same with black people. Like, is this doctor going to be a racist?
Yeah.
Like, I've never had to consider that in my life. And that's such a privileged position to be in. And it's crazy that people even have to consider that. Just, I've got to go to I have to ask this specific doctor because I know this doctor actually doesn't treat me well as a trans person. Like, I just honestly think that's so crazy. And I do like to think of myself quite but still, like, just stuff like this would never have even entered my mind.
There is this huge education piece to all of this, that all of us have got something to learn.
Exactly.
And all different generations, and how we bring up our younger generations and all of that. So there is an education piece that can be forgiven, I guess, after you've made I'm not quite comfortable with the way you phrased that or something. It's the continued
it's the
mistake.
It's the I know I'm doing something wrong, or I don't care and I'm going to continue. Like that, I've met plenty of people who've just gone. I'll be honest, like you're like the first trans person I've met, and I'm like, okay, cool, like good for you. You know, like that's good in a way, because now you get to see we're not just like a nebulous cloud of like evildoers lurking over the UK, like hiding in bathroom stalls, like
Bathroom stalls, ready to convert children into trans.
Exactly. Like, why would you want to be like
indoctrinating all people?
No, absolutely not. Like,
Honestly, outrageous.
like, it's just so relentless for so little. You know, it is being stoked up for very little, for very few reasons, other than it's a convenient little scapegoat.
Can I just bring it back to cancer screening and ask, like, maybe a fairly personal question? You don't have to answer if you're not comfortable. In terms of your body today, do you know all the things you should be checking for, the screening that you are potentially eligible for or could be eligible for in the future?
So again, it's quite hard to know, because it all depends on what letters are next to my name in terms of a gender on my record. And again, because of the way the NHS is, it might be that I'm picked up for a prostate screening from my GP, but then it doesn't translate across to the area trust. Might be NHS England want to send me something, but the local trust doesn't want to because it's got the opposite marker. Yeah. I know vaguely what things I should be looking out for, but I don't think that's a common thing. I think it's more because I'm a trans person working in the NHS in the UK. I want to know as much about that as I can. But again, because of...
But your average person, because they're not exposed to that on a daily basis because of their job, may not know that...
I think it's not just that. It's like, it makes sense for trans women to... Or it's I guess, logical for trans women to be at a higher risk of breast cancer than cis men. But not growing up with the warnings of breast cancer, you know, check your boobs every now and again, Copperfield advice, you know, I didn't know that about that until like I met Shelley, quite frankly.
Yeah.
I just, it never occurred to me. Yeah.
Have you found anywhere, and we've obviously mentioned Copperfield, but have you found any charities or anywhere that's kind of given some advice regarding trans or non-binary that you've thought, this is actually some good advice?
So, in general, the Macmillan pages and the Cancer Research UK pages do have dedicated sections for gender non-conforming and trans people and cancer, not just in terms of screening, but in terms of therapies in terms of mental health access, treatment, whatever it is. There are plenty of resources out there. In terms of organisations dedicated to it, Transactional UK are a really great one, as well as Outpatients UK.
Oh yeah, I follow them
Just
on
gonna write them
Instagram.
down.
Outpatients,
Who are lovely, and I do happen to be privileged enough to know one of the people,
Oh, do you?
one of the very small team working for
very
them.
nice.
But again, they're doing the work that they shouldn't have to, and they are doing a fantastic job, and I full-heartedly support them. It's just that you can't help but feel a bit sad that you have to have organisations that are dedicated to basically sitting down with GPs and saying, here's what you need to know about trans people before you proceed. For trans patients, going, here's what you're going to need to tell your doctor, basically. Here's what you're going to need to teach them.
But also,
they're
if we
fantastic.
flip the coin, like, thank God that there are for the people that
Exactly.
don't know where to turn. Like, everyone needs to start somewhere and feel supported. So,
Again,
as horrible as it is that there's a situation that they're needed, it is also great that they're there, because there will have been a time when they weren't.
Exactly. For so long, trans people have been and continue to be marginalised. Just whether that's overt, outright bigotry, or just getting lost between the cracks, falling between. That these organisations are doing fantastic work. It just happens to be that it's work they shouldn't have to do, and that the NHS by default should be doing. That being said, it's great to have them. They're really raising awareness, and it's fantastic to be able to see that there are organisations that are flourishing in the UK that are actually going, maybe all this discussion about bathrooms and pronouns is actually actively causing harm to patients, some of whom you will pass by in the street.
It also distracts some of it as well from what's actually important.
Well, it distracts from the real issue.
Yeah.
Well, again, with something like cancer, it becomes like we've been talking about the whole time. There are these inequalities that lead to trans people having different access to cancer treatment, and not just treatment, care, screening, appointments. There's all these little different barriers, and they do all add up. It doesn't have to be active bigotry to be participating. And I can't think of many people who would be like, actually, I quite like J.K. Rowling's opinions on these things, saying and endorsing like the statement, I think trans people shouldn't have equal access to cancer treatment.
On a really basic level, the cancer doesn't give a fuck. Like,
Exactly.
it doesn't care
No, it
that
doesn't.
you're transgender, that you're not. Like, it doesn't matter. It doesn't matter.
Exactly.
It's going to come for you if it's going to come for you.
Yeah,
come
it's
for you.
like it's not that's going to decide it.
Yeah.
And if we're all at risk of cancer,
Yeah.
it can happen to anyone. It's, what is it, 1 in 2
One in
people
two
eventually?
now.
Yeah.
And to just be like, yeah, but I don't really like trans people, so maybe let's not bother treating them. It's just
Let's
you
not
would
have them
you would
as
never
part of the conversation.
you would never
like-
actively say, or
No.
I'd like to think most people wouldn't actively say
No.
that, and yet these harmful discussions about, oh, who's using what bathroom, why aren't I as a teacher allowed to misgender a child? All this is just coming down to, it's the little things that are going to add up to trans people not having the same access to cancer care, any healthcare in general. It will mount up, and it will and has taken lives.
Yeah, and then we'll end up in the situation where in many, 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 many years to come, it'll be like, oh, the proportion of transgender people who are dying because of cancer is huge. I wonder why.
Exactly.
And you'll be
Yeah.
sat there going, hi,
Yeah,
I
hi.
actually know why.
I told you so on
Yeah.
1 lump or 2.
Did you not listen to my episode?
Yeah, it's just, we can sort of see it happening because we can see, with the lack of research being done, we can see the lack of research being done. With GPs and other healthcare professionals not knowing much about trans people, we can see that. We know it's happening, and little bits are being done, and places like Outpatients are doing active work to try and address that.
They
But
can only
it's-
do so much.
Exactly.
Yeah.
You can only do so much. It's continuing. It's going to continue. And just anything you can do to try and stop that, even if it comes down to just when you're talking about breast cancer, just say anyone with, well, just
Yeah,
anyone,
don't-
because
It's
anyone
not
can get breast
specifically
cancer.
women.
We
Yeah.
all
Yeah.
have breast tissue.
If I hadn't transitioned and I had a tumor in my breast, you would, most people would say, like, I would want you to be able to access care for that.
Yeah.
They wouldn't go, but actually it's women's health, so
Exactly.
no,
Yeah.
you don't get screened. Like,
Yeah.
Bye.
yeah.
No, I agree. Like, I think language definitely plays a massive part in it, and I think language definitely does need to change. I mean, things aren't just women's issues anymore. You know, even not even talking about cancer, like periods. Periods aren't just a women's issue. You know, anyone could menstruate. People who menstruate. Like, I don't understand why we can't. Just a simple change of language can open up healthcare to so many more people that wouldn't seek it because, you know, we as, you know, an institution, as the NHS, as just a society, just can't be bothered to change our language a little bit.
Yeah.
Like, it's ridiculous.
I do hope that because the younger generation and our generation, although I don't think quite as much as the younger generation, are much more accepting of change and moving things forward. I do like to think that in our lifetime we'll see a much more positive change for you, and that benefits
I hope so.
you. I don't think there's a lot generationally above us that will change, really.
That's such an. I really hate that, and I think you're right. But I think it's such an annoying thing when people use.
We're
the whole,
capable
like,
of change.
yeah,
It's not okay.
It's like, oh, he's old. It doesn't matter that
Yeah.
he's racist, or he's old. So it doesn't matter that he's transphobic.
It totally
Like, no,
matters.
we should all
Yeah.
be learning.
Yeah, totally.
And educating ourselves. We can't just do the whole like, oh, they're old, so it doesn't matter. Like,
Yeah.
I really hate when people say
It
that.
totally
like,
matters. I'm not saying that it doesn't matter. I think what I'm trying to say is that there is a huge shift happening below us
Yeah.
on the age scale, and things take time to change.
Yeah.
They do, and certainly something that, you know, if you want a radical change for healthcare, it is going to take
It will,
time,
yeah.
and because they're adults like younger than us, they've got the time, and they're also born into a period of time where it's a part of their conversation, whereas it wouldn't have been part of my granddad's conversation. So to him,
Exactly,
it's
yeah.
like so alien and scary. Don't whether he doesn't want to say the right or say the right thing, say the wrong thing. I think you get met with a much more blocker, like, no, this is what I believe, and I'm not prepared to open myself up a bit more, and that is not okay at
Yeah.
all. I'm not saying that that's acceptable, but I do hope that because of where we are, and I do think our generation's kind of on the tipping point here, that the change could flip.
I think, so. Yeah. I mean, from a sort of personal experience, it seems to me that a lot of it just comes down to actually meeting trans people.
Yeah.
Like, because, again, we're such a small proportion and yet talked about so much in the UK, it's flattering. It's not always
I'll
a good
also
thing.
vouch,
But
you're totally, like, you're just a human being.
Exactly.
Like, there's,
And
not to invalidate you or anything, but
No, of
there's
course.
nothing special about you. There's nothing special about Shelley and I sat here.
Exactly.
Like, we are all...
okay, maybe just Shelley then.
Maybe
I
just
guess.
Shelley. But do you know what I mean? Like, we're all just
Exactly.
people. That's what
Exactly.
all of this boils down to, and we all deserve
Access to
safe
healthcare.
access to healthcare.
It
and
just comes down to, like, I don't want to be this sort of weird monster that I'm being made out to
Yeah.
be, because chances are, like I've got plenty of colleagues. There are people who I just know socially who are different generations. You know, whether it's family or friends, whoever. Most people just shrug it off. It just comes down to whether, if someone comes down and just says, like, oh, I think trans people are a trend. It's a, who knows? It's a cult. It's what have you. They're all coming to transify our children. Whatever.
that's a great word.
Whatever have you. And then I come in and go, hi, I'm a trans woman. And then they go, oh God,
Oh my
What?
God.
what is that person going to do?
Nothing.
I'm
I'm just going to talk to you like a fellow decent, civilized human being.
Exactly. I just want a coffee. There are times when I feel sort of fine about it because I'm surrounded, fortunately, by very kind family, friends, colleagues who are very understanding, and when they don't understand, will ask and try and learn. That being said, every time you turn on the news, there's something about trans people, and it's usually framed in such a way that it makes us seem like inherently horrible people, and I just don't understand why.
And even if you are inherently horrible people also get cancer.
Yeah, exactly. Exactly. Like, why exclude us from the conversation, or just have a conversation about us without including us?
Yeah.
I won't go on a whole diatribe about it, but the CAS report did not include any trans people like on the panel.
Did it not?
It actively denied them, like trans people, the right to sit in on the panel about trans healthcare in the UK. It's just
whoever makes these, honestly, that is like mind-boggling. Like, especially if you are going to talk about access, like trans access to healthcare, why on earth would you not put a trans person on the panel? That makes absolutely... People are stupid, or just ignorant, or both, or just...
You say it makes no sense, but in my head, it does make sense, because there was no point that report was not going to go in the direction of we should not be giving puberty blockers to children. These are irreversible changes. They're, life-altering decisions, which is true, but divorce rates marriage has a higher regret rate than transitioning.
Having children has a higher regret
Knee
rate
replacement does. Hip replacement, but we're not having a national conversation about it. There's so many stats that have like
such a high regret rate, and then you look at people who are transgender, it's like less than 1% regret rate or something like that.
But the few people that do detransition get to...
They're the ones that are picked up on.
Yeah, exactly. And you go, look, people regret this. And it's like, yeah, people do, but people regret
a lot of
getting
things.
married. I regret not buying an extra pack of coffee. I ran out today. I'm really annoyed by that, but I'm not turning it into a national conversation, you know? It's such a low rate, and it helps so many people. We've talked about barriers to cancer and things, but it goes the other way as well. It's not just preventing bad things, it's allowing good things to happen. Even if my rates for cancer or whatever, or any health condition remained flat, I was miserable before I transitioned.
100%.
And although it was life-saving care,
let's
say it wasn't life-saving care and it just would have made my life a bit happier. Why
deny you of that happiness? It doesn't matter.
Exactly. It's just so mind-boggling to me that so much can be made about so few people and such small decisions that basically just make people happier.
It just completely dehumanizes the human.
It just comes down, it does. It dehumidifies. Dehumanizes.
It might do that as well.
It's bizarre to me.
Do you think, and you probably don't know, I know you might not have an answer, but do you think it's going to kind of change for the better within our lifetime?
I would hope so.
Yeah.
I really would hope so. The main barriers that I have in my head are that although there are plenty of individuals who are willing to say, actually, maybe trans people should be allowed the same access to healthcare, should be allowed rights, there's always going to be this element of, because we're so small in number, so few in number, that we can be easily scapegoated, Again, I won't go too off topic, but it happens with migrants, it happens with sex workers. It's just small number of people, something you're not familiar with, that's an easy target.
Yeah.
It's so easy to just pin all the evils of Western civilization on trans people, and it's just not there. Because so many individuals are making such big changes and starting to stand up, I do hold out hope. Even podcasts like this, Transactional UK and Outpatients UK making changes. We're seeing slowly trickling down, even in the NHS, of sort of care flows and things that take into consideration trans people. Just training that allows and just says, hey, if you've got a someone you're not sure how you should gender them, ask, make a
Yeah.
note. Things like that are starting to become more commonplace. I hold out hope that these are going to become the norm,
Yeah.
but it's not going to change overnight.
No.
It's going to be a long fight. And my little plea to the listeners at home is don't stand up for trans people, but stand up with us, because we do need the numbers. There are not many of us. We do need the numbers to be able to push for change. And it starts with the little things like just changing the language you're using.
Yeah.
And it ends with the big things like having trans people get the same access to cancer care that other people do.
Yeah. Well, that seems like a good
That
note
felt
to
like a
end
really
on.
natural end.
Yeah. Is there anything else that you wanted to say? Cover?
Just to reiterate, trans people are not here to harm you. Giving rights to trans people does not take rights away from you. It doesn't diminish your life. It improves everyone's. We get a more diverse society. It can only be a good thing. Other than that, drink plenty of water, wear sunscreen, and check your breasts every month.
Every month. Thank you so much for talking
Thank you
to
for
us.
having me
I
on.
feel like
Thank
I've
you.
stared very intently at you the whole way through,
Yeah.
but I've just been completely captivated by everything you have to say, and I feel
It's
like
been
I've learned a lot
It's
as well.
been so eye-opening, and I've learnt so much, and it's just been incredible to have you on. So thank you so much for talking so openly as well about everything.
No,
And
thank you for asking. And again, you don't get told unless you ask. And by you asking, people get to hear me. People get to actually start thinking about these things. It does have a trickle-down effect. And thank you so much for giving me the chance to do it.
You're
Thank
welcome.
you.
If you want to share your story, we'd love to hear from you. Whether you've had cancer, you know someone that's had cancer, or you just love listening to our voices. Slide into our DMs on Instagram at onelump_or2.
Or email us at onelumportwopod@gmail.com.
See you next week.
Bye!